Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. More concerns on the Delta variant as pharmacists in the country ask Nigerians to adhere to all safety protocols. Following recent nationwide resident doctor strike, members in Taraba demand COVID-19 inducement allowance among other benefits. And 7 residents of a nursing home in Belgium die after being infected with the Colombian variant of COVID-19. And 11 people have died from COVID-19 complications. The Nigeria Center for Disease Control made the announcement just as it recorded 566 new confirmed cases in 12 states. Total active cases now stand at 9,066. Let's take a look at the latest report.
The ability to stop COVID-19 is in our hands. The NCDC is reiterating this message, encouraging all Nigerians to boost their collective action to prevent the further spread of the virus. In the last 24 hours, the agency announced 566 confirmed cases reported from 11 states and the FCT, indicating a drop from the 737 cases reported earlier. More than half of the infection figure was recorded from Lagos, which had 283 cases, followed by Akwa Ibom, which reported 88. Oyo and Rivers State registered 62 cases. 18 were reported in the FCT, Ogun had 17. 12 cases were reported in Ekiti, Kwara registered 11, Plateau had 6, Zamfara 3, while Kaduna and Katsina had 2 cases each. There were 0 cases reported from Edo, Nasarawa, Ondo, Osun, and Sokoto. The latest tally raises the number of confirmed cases in Nigeria to 176,577. 115 persons have been discharged in the last 24 hours, increasing the total number of recoveries to 165,323. The NCDC also reported 11 additional deaths from COVID-19 causes in the last 24 hours, raising the fatality toll to 2,178. Presently, there are now more than 9,000 active cases in Nigeria, while over 2.5 million samples have been tested so far. 29 people associated with the Tokyo Olympic Games have tested positive, making a total of 382 confirmed cases as compiled by the Games Committee. Over 6.9 million confirmed cases and more than 174,000 deaths have been recorded across countries in Africa. The total global confirmed cases have now surpassed 200 million, while more than 4.2 million deaths have been reported.
The Association of Hospital and Administrative Pharmacists of Nigeria and the Pharmacists Society of Nigeria are calling on the federal government to avoid another lockdown due to the outbreak of the Delta variant of COVID-19. They are advocating more sensitization and awareness on the virus, the non-pharmaceutical interventions and vaccines to stem the tide among the populace.
And I'm sure very soon you will start seeing that
is the 22nd Annual National Scientific Conference of the Association of Hospital and Administrative Pharmacists of Nigeria in Ilorin. They are gathered to discuss how to improve the health sector through provision of high-quality pharmaceutical care to the Nigerian people. Permanent Secretary of the State Ministry of Health, representing the Kwara State Governor, says the government is ready to partner with relevant professional bodies to fight against COVID-19.
We know what you need. We are doing what you want of us and not necessarily what we want of you. And at the same time, we also have to put on the table what we expect of every professional body in the state. So far, so good. The pharmacists as a team have been complimentary and highly responsive in the dreams of Kwara State government.
While many Nigerians who have not been vaccinated remain potentially vulnerable, groups represented here emphasize the need to adhere to all safety precautions and fast-track measures for more Nigerians to get access to vaccines.
It's important for us that we observe the protocols, observe social distancing, okay, observe hand washing. As hospital worker, we must abide by this. It's very important for us. Social distancing, hand washing, personal hygiene. All right. and generally too, in terms of health education. Okay, we are trying to pass out information to the public.
Do not lower your guard, because it's better to prevent the disease than to be sorry. We are seeing the increase in the number of infections. We are seeing the increase in the number of deaths. So it cannot be a lie. So let Nigerians be careful, simple, wash your hands, use hand sanitizers, maintain social distance, and wear masks. And then if you have opportunity, go and be vaccinated. Get your vaccination. Thank God Moderna vaccines are in the country now. Let people go and get their vaccination.
The association promises they will continue to rise to the challenge of the pandemic, including the administration of drugs and production of hand sanitizers and disinfectants as part of preventive measures to check the spread of the infection.
And in spite of the appeal to resident doctors by the federal government to resume today, saying it's a state matter, the National Association of Resident Doctors are unrelenting as industrial action enters day 5. In Taraba State, the resident doctors are lamenting the inability of the federal government to pay their COVID-19 inducement allowances, despite paying others across the nation. They're insisting that the strike is born out of empathy for members of the public. The association is calling on government at all levels to review its stand now to avert the effect of the Delta variant of COVID-19. They also revealed that the association is organizing a telemedicine to address outpatients online.
COVID-19 inducement allowance that have been paid across the nation, we have not received a token. They just sample some few doctors in their isolation center and give them what they feel like giving them to say that they have paid COVID-19 inducement allowance. I now ask myself, who are the people referring patients to those isolation centers? Who is more at risk? The person that will see a patient in the peripherals and then determine whether or not the patient is a COVID patient before sending to an isolation center, or a doctor that is already in the isolation center that already know that this patient is COVID positive, that should be paid. So all these issues are bothering. We don't know. The government are just paying lip service to many things. At the end, we will just spend so much money, train medical doctors and send them outside the country, because the working environment here is truly harsh. Dr. Ame is one of our members in this state. He died 5 to 6 months ago with COVID. The government have not given anything. How do you now want us to come and put our life in the front for others? This strike is born out of empathy for the general public, if I want to tell you the truth. It's born out of empathy because if we continue like this, the whole health sector will collapse. Is it that time that we'll start standing up to do anything?
A civil society organization in Yobe State has expressed concern over the increasing number of gender-based violence cases during the COVID-19 pandemic, and the group is calling on the government to provide severe punishment to all perpetrators. The Executive Director, Women and Youth Empowerment Initiatives, made the comments at a 2-day capacity building training organized for survivors of gender-based violence in Potiskum, Yobe State.
One would say the problems women face during the COVID-19 is just an additional problem on top of what women are already facing, because, you know, women are marginalized and are also going through a lot of hardship, which is also driving them into going into activities that we'll call GBV. From our end, Women and Youth Empowerment Initiative, WOYIN, we have formed a consortium of local partners who are intervening in this gesture, trying to build the capacity of women on GBV and then give them capacity to be able to now go into leadership and decision-making positions that will help them curtail the menace of GBV in the society.
The World Breastfeeding Week is an annual celebration held every year from August the 1st to the 7th in over 120 countries. And the World Health Organization states that breastfeeding is one of the most effective ways to ensure child health and survival. In Nigeria, the government has shared their targets for breastfeeding for the years to come, which is that Nigeria is expected to attain 50% exclusive breastfeeding targets by 2050. Well, joining us for more on this is the Managing Director, Vivian Hekwazu. She's the MD, Nigeria Health Watch, and she joins us now from Abuja studios. Thank you for joining us on the program.
Good evening, Millicent. Thank you for inviting me on your show.
Welcome again. Tell us, how different is a child who is breastfed from one who isn't?
Okay. Well, the WHO guidelines and most health guidelines state that a baby should be exclusively breastfed for the first 6 months of their lives. They should not be given anything further. And the recommendation is they should be breastfed up until about 2 years. But for the first 6 months, they should be exclusively breastfed. They shouldn't be given any water or any other complementary foods or otherwise. I mean, this is because breast milk is the most natural product that you can give a newborn baby. It contains all the nutrients. The breast milk provides the baby with the antibodies it needs to stay healthy. And so breast milk really is the best start any mother can give to her child.
So how would you say COVID-19 has impacted the role of breastfeeding in child development?
Well, at the onset of the pandemic, I'm sure there was a lot of anxiety around the impact that COVID-19 would have on breastfeeding, but the guidelines have remained the same. Women have been advised to continue breastfeeding irrespective, because breastfeeding really is the most natural way you can protect a baby when they're born. The same health precautionary measures that we are all advised to take, we should adhere to. The basic hand hygiene, washing our hands, keeping a distance, all those things are recommended for pregnant women and nursing mothers to protect themselves and their babies. But ultimately, irrespective of whatever is happening and the pandemic, women have been advised to continue to breastfeed, because that is the best way any baby can start their lives.
Some questions also abound, especially for those who might suspect that they have COVID-19. What are they expected to do then?
Okay, there's a lot, I mean, as I mentioned, there's a lot of anxiety initially as to what pregnant women should do if they suspect or if they come into contact with somebody who may be suspected of having COVID-19. But the most natural thing the best thing a mother can still do is continue to breastfeed. I mean, now, especially with, you mentioned in the early part of the show, with variants, etc., that are taking hold across the world, for any nursing mother, and for all of us really, when you have a newborn baby, all the precautionary measures you would take when you're trying to prevent COVID-19, pregnant women should continue to do. But once a baby is born, especially within the first hour, that early initiation of breastfeeding is absolutely critical, because it enables, a mother to bond with her child and enables the baby to get that first productive and most nutritious colostrum, the early milk that a woman produces once she's had a baby, to be fed to the baby. And these are the defenses, really, that enable a baby to stay healthy. In Nigeria, we have many health challenges. We've got 37% of babies are stunted, and this is a big issue that we have got a lot of work to do still. So really, breastfeeding remains the best start any baby can get when they are born, and the best thing a mother can do once they've just given birth.
All right. As we wrap up, if I confirm that I have COVID-19 and I'm a lactating mother, can I still breastfeed my child? And then the federal government has announced that, neonatal deaths have been sort of averted, recently in Nigeria. How well is Nigeria's world doing? And this is the kind of workplace policies that exist for lactating mothers. An example is the less than 6 months maternity, or some would say paternity leave for women, for workers.
Okay, well, that's a very good question. Taking your first question about lactating mothers, there's actually been no evidence that COVID-19 can be passed on to breast milk. So women are advised to continue to breastfeed because that is really the best way you can provide your child with defense. And, unfortunately, with the variants, women are more vulnerable now. And so in as much as we talk about protecting women, we haven't even mentioned the impact of ensuring that pregnant women get vaccinated. That really is the best way for them to protect themselves and their babies. Yes, and leading on to your second question, the theme this year of breastfeeding is Protect Breastfeeding, a Shared Responsibility. And that shared responsibility responsibility is one that's borne by workplaces, borne by communities, borne by families. And in the workplace, currently, we have about 3 months maternity leave for new mothers. And the advice is really to support women as they start and continue their breastfeeding journey by extending maternity leave to about 6 months. I think COVID-19 has really shown us that flexible working is possible. So the plea is for workplaces to support women to continue to breastfeed up until 6 months so that they can continue to exclusively breastfeed their children for the minimum of 6 months, and thereafter continue to breastfeed. So that shared responsibility is also, the role of the workplace, because these are the future. These are the future of the country. So the best we can do to ensure that we have a healthy generation growing, the best we can do for Nigeria as a country.
We'd like to thank you so much, Public Health Advocate Vivian Ihekwazu, Managing Director, Health Nigeria Watch. Thank you so much for your expertise and time on the program.
Thank you so much, Millicent, for your time.
Still to come on the program, a third wave of COVID-19 rages across Africa as deaths reach record peak. We have the figures when we return. Welcome back. The World Health Organization says coronavirus-related deaths in Africa reached a record peak in the week ending August 1st, as more than 6,400 deaths were recorded. That's a 2% rise on the previous week, with South Africa and Tunisia accounting for more than 55% of the fatalities and deaths on the rise in 15 countries. WHO Africa official Fiona Atubewe says COVID-19 cases across the continent were rising again after a slight dip, and the third wave of the pandemic is still raging at full force.
Africa is still on the crest of a third wave and still recording more cases than in any earlier peak. We cannot take anything for granted, and we must stay fully committed to proven prevention measures. Tragically, deaths in Africa reached a record peak this week with over 6,400 deaths recorded. The third wave of the COVID-19 pandemic in Africa is still raging at full force. After a slight dip in cases last week, COVID-19 cases are surging again, rising by 19% to nearly over 278,000 this last week. Turning to COVID-19 vaccines, after a tough 3 months, we are seeing more positive prospects as vaccine shipments to Africa start picking up.
And European countries have started introducing restrictions on people who haven't been vaccinated against the virus as COVID-19 cases rise again across the bloc. In France, plans to make a COVID-19 health pass mandatory for access bars and restaurants sparked protests across the country when the country's top court on Thursday approved the controversial rules. Well, Chelsea Delany, Deutsche Welle correspondent, tries to make sense of it all for us, and she joins us now from Berlin. Hi, Chelsea. So the court says requiring the health pass is legal. What can we expect when it goes into effect on Monday?
We can definitely expect some degree of controversies. So starting Monday, people in France will be required to show this COVID pass that proves if they've been vaccinated or also tested negative or recovered from coronavirus to enter restaurants, cafes, to use transportation like planes or buses. Already, these plans have sparked huge protest in France, drawing hundreds of thousands of people who say this is an attack on their freedom. Businesses are also concerned that this will drive away customers, and it's true that many businesses have struggled to enforce other rules like mask mandates among their customers. But at the end of the day, the court in France has decided that this is what they call a balanced trade-off between public health concerns and personal freedom.
Will the French court's decision encourage other EU countries to implement similar rules?
It could definitely have a ripple effect. Many EU countries have been considering similar measures, particularly as COVID-19 infections rise once again due to the Delta variant. Italy is probably the most prominent example outside of France. It already has implemented rules requiring a health pass for things like eating indoors at restaurants or going to the cinemas. And Italy announced yesterday as well that it will require teachers to prove immunity to coronavirus as well. Here in Germany, politicians have been more cautious about introducing rules on the unvaccinated, but they have warned it might be necessary if we see a larger wave of infections in the months ahead. Of course, every court, every constitution is different, but the fact that France has deemed this constitutional could give other countries more confidence to implement similar rules.
Is this enough an incentive to get people to get vaccinated, or are other tactics under consideration here?
Well, countries are looking at a whole range of options to increase vaccinations. In Europe, the problem is no longer supply. There isn't a shortage of vaccines here. The problem has now become getting people to get vaccinated. Implementing vaccine mandates is definitely a harsher approach because it makes life effectively harder for those who choose not to get vaccinated. But it does appear to be working. In France, vaccination rates have definitely picked up since the government announced plans for this health pass mandate. But countries like Germany are also considering softer methods, like, for example, giving people bratwurst at vaccine centers, or in some cases giving them money for getting vaccinated. Those things can help, but vaccine hesitancy remains a major problem for Europe and for the rest of the world.
Thanks very much, Chelsea Delaney, DW correspondent, joining us there from Berlin. And as the world continues the battle against the COVID-19 pandemic, authorities in 221 countries and territories have reported about 201.2 million COVID-19 cases and 4.3 million deaths. Here's the latest development on our global update.
7 residents of a nursing home in Belgium have died after being infected with the Colombian variant of the coronavirus in spite of being fully vaccinated. The variant of COVID-19 that originated in Colombia has been detected in recent weeks in the U.S., but cases in Europe have been rare. So far, scientists do not know if the Colombian variant is more transmissible than other variants. In the Philippines, the Manila capital region has enforced a third COVID lockdown in a bid to contain the spread of the Delta coronavirus variant. Infections in the country exceeded 8,000 a day in the past week, with around 1.6 million cases and more than 28,000 deaths. The Philippines has the second worst outbreak in Southeast Asia after Indonesia. South Korea has announced the extension of social distancing curbs by 2 weeks as the government contends with outbreaks nationwide and more people fall severely ill. The government had tightened restrictions last week across most of the country ahead of the country's peak summer holiday period. Officials say the restrictions are crucial to stamping out cases and ensuring a safe reopening of schools in 2 weeks. The World Health Organization says coronavirus-related deaths in Africa reached a record peak in the week ending August 1st. More than 6,400 deaths were recorded, a 2% rise on the previous week, with South Africa and Tunisia accounting for more than 55% of the fatalities. And finally, Australian Prime Minister Scott Morrison has ruled out the use of rapid antigen testing and mandatory vaccinations. Over 60% of Australia's 25 million citizens are under strict lockdown as the country has battled to contain the latest surges of the COVID Delta strain.
Well, over in Senegal, a hospital in Dakar, health officials are scrambling to control the COVID-19 virus as they battle a third wave that seems to threaten and overwhelm the country's hospital. Let's take a look.
At Dalal Jem Hospital in the Senegalese capital, Dakar, only the sound of a ventilator and beeps from a monitor indicate that the pregnant woman in intensive care is still alive. A few cubicles down, another woman is on oxygen after giving birth while sick with the coronavirus, as a third wave threatens to overwhelm Senegal's hospitals and some of its cemeteries.
We are exhausted, physically exhausted, but above all, emotionally exhausted, because this third wave is above all the wave of youth. There are young people, both men and women, but above all, there are many pregnant women, and that emotionally exhausts us.
Health Ministry figures show Senegal, which until July had recorded fewer than 44,000 COVID cases and 1,666 deaths, has registered more than 20,000 cases and 250 deaths since the start of July. A short drive from the hospital, gravediggers at a Catholic cemetery are struggling to keep up with the number of burials.
Since the third wave arrived, we've been working until 10 p.m., which never happened before. Our workload has increased. Also, before, we did not build the graves the day of the burial. We used to build the graves the day before so that the burial could be done the next day. But if you look at the one behind me, we built it today and buried it today.
And the West African nation is not alone. The World Health Organization said on Thursday that coronavirus-related deaths in Africa reached a record peak last week, partly spurred by the highly transmissible Delta variant.
Remember that the coronavirus can live on the surface for several hours. Continue to take responsibility. Avoid sharing personal items. Disinfect frequently. Wear a face mask. Wash your hands. Maintain a distance. You can find more updates on our website. It's channelstv.com. Breaking news and a better understanding of the pandemic. That's the program for the week. Thank you for watching. I'm Millicent Mwaka. Stay healthy.